Pathways to Housing was created to end homelessness for people with mental health, and addiction problems. People who are homeless, literally living on the streets or in the parks or public spaces or going in and out of shelters or jails. Most organizations serving this population require that their clients first obtain treatment or sobriety in order to be eligible for housing. Our Housing First program was developed as an alternative to that. The program, Housing First, offers prospective clients an apartment of their own, directly from the streets, and then provides the support and treatment services they need in order to ensure their success in maintaining that apartment and also to support them in integrating fully into their communities. In addition to continuing to provide the highest quality of mental health care and addiction services for our consumers, we'd like to expand our service array to include health care and employment services for the people we currently serve. Another major objective for our agency is to increase the number of agencies across the country that will adopt the Housing First approach so that we can truly end homelessness for the most vulnerable across the country. We're seeking to open Pathways programs in new locations, as well as to provide consultation, training, and technical assistance to agencies and governments or counties that want to implement this model. We are working with the Veterans Administration on their goal of ending homelessness among veterans by using our Housing First approach. We are also negotiating with several cities to identify the resources to introduce a Pathways Housing First program. There are several important things that our program has accomplished. It provides a humane and effective solution to chronic homelessness. It provides person-centered clinical and support services that have demonstrated positive results in addressing mental health and addiction problems. And the program is cost-effective. This is perhaps the most counterintuitive finding concerning Housing First, that it actually costs less to provide housing and support than to pay for shelter, police, jail, emergency room, and other costs that are incurred while people remain homeless. The effectiveness of our program is due to its philosophical orientation and the way that that philosophy has been turned into practice. The program uses a person-centered approach where the client, not the clinician, determines the type, sequence, and intensity of services. This ensures that the program is providing services consistent with the client's priorities, producing remarkably effective engagement. The program is also effective because it embraces a social justice approach to housing and poverty. That means that clients are offered housing right away as a matter of right because they're homeless, not something they must earn by proving themselves ready or worthy for housing by first participating in treatment. We use several metrics for measuring success in the program. First, does the person get housed and stay housed? Do we end homelessness? We measure this by how quickly the person gets housed. Our expectation is that the person is housed between 2 and 4 weeks, and the person stays housed. We've looked at residential records and people are housed for 10 years or longer. So yes, they do get housed and stay housed. Are there indications that the person is doing well clinically and socially? This we measure with looking at mental health and addiction problems. What our data shows is that participation in the program for treatment increases after the person is housed. We see reductions in psychiatric symptoms, less drug-alcohol use, and increased measures of social engagement such as family reconnection. And lastly, does the program have an impact on the person's economic recovery? And there again, we're looking at improvements in quality of life and the extent to which the person has discretionary income. Are they participating in educational programs? Do they have a volunteer or paid job position? or are they otherwise engaged in productive activity? And we see increases in the positive direction in all of those areas. There are two dimensions of our work that are not commonly understood. One is that the person we house bears the same rights and responsibilities as any other tenant in the building. This is not a freebie program. People are required to participate like everyone else in the community in terms of being a good tenant, a good neighbor, a good citizen. They pay their rent, and they have the same responsibilities as a neighbor as everybody else. We want to even the playing field so that people are treated the same, not different, because of their disability. The other dimension of the program is the recovery services. A lot of play on Housing First is on the housing part, ending homelessness. But the bulk of our work is all about the recovery. What happens after the person is housed? How do you put a life back together? What kind of supports do they need? How do we get them reintegrated with their family? A job, education. These dimensions, time-consuming, are actually the bulk of the work that we do, and that doesn't get as much play as the housing part. Our organization's major accomplishments include the effectiveness and remarkable growth of the Housing First model over the last 20 years. We started in 1992 with 50 clients, and today we directly serve over 3,000 people. And with our training and consultation to other agencies across the country and in Canada and in Europe, we have ended homelessness for tens of thousands of people. I would say our greatest accomplishment is in developing this model that has provided the opportunity for people who are mentally ill and homeless to demonstrate to us that they are capable of much more than we ever imagined possible. Initially, our biggest challenge was changing the value set of other providers to shift from treatment first to housing first. I think we've made some gains in that direction. The challenges we face currently have a lot to do with funding. The government pays for rent and support services that are just enough to get someone into housing, but are not keeping pace with the increased cost of living or rent increases that people face. So the struggle to leave the margins of poverty and enter into the community fully remain huge. We have funding for basic services, but not job development, for simple rent, but not food, education, trips to visit family, or any of the other things that go from existence to having a life. The funding we receive is almost entirely government contracts. While these contracts pay for basic needs such as rent and support services, all other needs a person has, educational, social, employment, cultural, are not part of this basic package. Once housed, people stop worrying about survival and start thinking about doing something more with their lives, reconnecting with family, getting a job, having a relationship, going back to school, finding a place of worship they can go to. Providing classes, social activities, support to get and keep a job, learn about nutrition, cooking, new skills, photography, writing, are all part of the interests of the people we serve. And if we had additional resources, we could significantly improve the quality of the life of our program participants and help them to go from where they were, which is surviving, to where they want to be, which is thriving. There are segments of the homeless population that could greatly benefit from a Housing First approach. The approach was initially developed for individuals with mental illness, but it can be easily expanded to include serving homeless families, families especially who have a member with some disability, It can be expanded to take people with mental illness who are in and out of the criminal justice system and provide housing and supports for them to reduce the recidivism into that system. And it can also house people in a community integrated way who are currently living in psychiatric hospitals or large group homes so that they too will be integrated into the community.